of care in a timely fashion. Every word is important. Continuum of care. Our system is not, we think it's universal. There are things that are not fully included in our system. Just think about long-term care and pharma care. Second, create incentives for enhancing access and improving quality of care. This will require putting in place innovative methods of funding, such as activity-based funding, where patient will be seen as a revenue center rather than a cost center. We have been told in every country we went to Europe, this is the first thing you should do. Change the way you're funding your hospital. We are the last one using block funding. Everywhere, funding of hospital is based on activity. The mindset is very different. We should do that. Third, improve access to services that are presently outside of Medicare. And I'm talking about pharmaceutical coverage and long-term care. Pharmaceutical coverage is very uneven in Canada, and you know that probably. For one time in Quebec, we have a good system. For one time, we have a good answer in Quebec. Our system for pharmacare is working. It's a universal system that gives a coverage for everyone with the deductible and the co-payment, but it's working. So it should be like that everywhere because this is part of the treatment. Medicare is forgetting that part of the treatment. We should work on that again. 4, providers help patients and ensure that there are more doctors to provide care and that they have the appropriate information technology support to provide efficient care. This could include making better use of resources such as physician assistant. This is something that exists. It's starting in Ontario and Manitoba. It exists in many countries, and it could be helpful to have that. Those people are trained in a very short period. The training is 2 years, and they could help in the operating room and do some work for you. They are physician assistant. It's under the supervision of a physician, but it could be helpful. We're not using those people because we're not training those people. But it's starting in Ontario and Manitoba this year. And last but not least, increase accountability and responsibility at all levels of the system. These 5 directions were developed to provide the starting point for a fundamental discussion about transforming the system so that it better meets the needs of Canadians. Transforming Canada's healthcare system so that it puts patients first is critical. The system must serve the patient, not the other way around, as it is often the case today. Canada's physicians can and must take a leadership role to help Canadians achieve this goal, and we need government to do the same. This work will continue this summer, leading up to the annual meeting of CMA's General Council in Saskatoon this August. There, physician delegates will discuss and debate directions and set a course for further action. The course for action will focus on patients. It will be about building the best system for patients. It will be about lifting the fog, and you know what I'm talking about here, the fog of political posturing that has clouded the vision of Medicare for far too long. Now is not the time for us to stick our heads in the sand. We need to take a hard look at all potential avenues, including the appropriate role of private delivery of healthcare services within the public healthcare system. And I'm not talking about privatizing the system. Don't worry. It's the use of the private sector where it's possible, where it's suitable to do that. And it's not everywhere, I understand that. But if it's possible, why not? Under the transformation umbrella, CMA research shows that having enough healthcare professionals, it's a common trait shared by high-performing European health system. In all those countries, they have more doctors than what we have here. Clearly, health workforce shortages plays a key role in our ability to build a system that truly put patients first. And I know that this area of significant concern for the NLMA and physicians here. At the federal level, I've met with the House of Commons Standing Committee on Health, where I made 12 practical recommendations that fall completely within the jurisdiction of the federal government. These recommendations center on investing in the capacity needed to expand and retain our practicing physician population. These recommendations are a clear call for pan-Canadian planning and innovative thinking to meet the ever-increasing demand for physician services from the Canadian public. And these recommendations are based on three clear goals. One, ensure all Canadians have access to a family physician. Two, establish health human resource planning based on current and future needs of the population. And three, reduce our dependence on international medical graduates and strive toward greater self-sufficiency in the supply of health human resources. Our system could not function without IMGs, and I know that this is very important in Newfoundland here. However, the CMA contends that we must do more in terms of strategic health force planning so that we can provide timely access to care for all Canadians. In closing, I want to offer my appreciation and that of the CMA for the work and dedication of NLMA members to strengthen the national voice of medicine in Canada. And I want to salute, in particular, Newfoundland members of the CMA's core committees, specifically Dr. Wendy Graham, Andrew Major, Terence Callan, and Lydia Thatcher, and also the work of Dr. John Haggie, who is a member of the CMA Board of Directors, as you know. And as you know, after General Council this year, there will be significant changes to the CMA's representative bodies. However, the revised structures will continue to depend on the commitment and dedication of physicians such as those I have mentioned to ensure strong representation of members. Transforming the system is not an easy task, and I understand that it can be a destabilizing prospect for people. People don't like to change, and I've been told that only babies like to change. The physicians of Canada will not abandon our leadership role in ensuring that we build a better focused patient system. Physicians can and must provide important insight and knowledge needed to enhance the system in a way that it will ensure quality care and optimal use of resources in a sustainable way. Ensuring that happens requires that we work together, raise our voice, and press for action. And the time is now, and we can do it. Thank you very much.